Measles popping up across the country, causing concern and one confirmed death. Thank you so much for joining us here at 5 o'clock. I'm Brittany Decker.
I'm Guy Rawlings. According to the Texas Department of Health, where the child died, 124 cases of measles have been confirmed there alone.
WVTM 13's Aaron Llewellyn is live tonight at the Jefferson County Health Department. And Aaron, while there haven't been any cases here yet, health leaders are watching this outbreak closely.
Yeah, Guy, Brittany, earlier today I talked to a doctor here at the Jefferson County Health Department, and he tells me that doctors here are monitoring those cases being reported nationwide closely. Now, that death that you mentioned in Texas is the first death caused by measles in 10 years, and doctors say that they want to make sure that they encourage everyone to protect themselves as best as they can. Fear of the measles outbreak growing across the country.
It has very severe consequences.
Some say almost as quickly as the disease is spreading.
We're very early on in the year, so we've got a lot of time left to cover before we close out 2025.
A Texas health department confirming a school-aged child died after being infected with the disease.
That's where you're going to see the really intense complications where children can land in the hospital, that they can have an inflammation of the brain. They can unfortunately end up passing away from this.
Right now, the Center for Disease Control reports 124 cases across the country. 3 out of 10 of those are children ranging from newborns to 5-year-olds, while 50% are ages 5 to 17.
About 2 out of 1,000 children can die from the infection with it. You'll see very high rates of hospitalization due to pneumonia from it. It's a very serious infection and one that we really don't want to deal with.
In 2024, the CDC reported there were 285 cases in the U.S., even though that seems like a small number. Dr. Wesley Williford with the Jefferson County Health Department says health officials fear the unknown.
As that begins to wane, as fewer people begin to take that vaccine, we become vulnerable to this very contagious virus. It's very contagious.
Williford suggests anyone with children or people with pre-existing health conditions or of an older age consider getting the vaccine.
It's up against a virus that's very easy to spread. In fact, it's one of the most contagious viruses that really we have discovered in the scientific community. So it's something that we have to have very high rates of vaccination to really have protection against it.
Now, if you haven't been vaccinated before, Dr. Williford suggests considering it, especially if you have a child under the age of 5, are a senior citizen, or have pre-existing health conditions. He suggests talking to a doctor to help you make the best decision for you. Live in Birmingham, Aaron Llewellyn, WVTM 13.